I'm gonna throw it to you. You ready? Catch it.
Oh, my head!
Gloria was born premature at 25 weeks and 3 days gestational age. And so that was a lot earlier than we were expecting. So we knew that right away, she was going to have more challenges than your average newborn. At 35 weeks gestational age, she had an MRI done while she was still just a tiny little baby. And it did show significant atrophy of her left hemisphere. And the read on the radiology report confirmed that she had leptomeningeal angiomatosis, which was a classic symptom of Sturge-Weber syndrome. About 1 month after she came home, we noticed that she started having some odd behavior, some eye twitching, some abnormal drooling, some abnormal lip movements.
So we brought her into the hospital, put her on EEG, and we found out that these were indeed seizures. I mean, she was having many of them. And we tried multiple medicines when we found that they didn't work. And just knowing the natural history of Sturge-Weber, we knew that after we've tried 2 medicines or so, that she should be evaluated for surgery.
The reason why we all felt confident about helping her find a cure for her underlying condition is firstly because there's excellent data available that indicates that young babies who have very severe epilepsy with underlying Sturge-Weber actually do really well with the surgery, provided we can do the surgery expeditiously and safely.
I remember we had her swaddled the morning of surgery.
Because she was so young, and we are always concerned about both the length of surgery and the blood loss, and I had discussed with the parents the potential need to stage the surgery in 2 different phases.
She left at around 7 in the morning, and she got back to her room at 9 p.m. at night. So she had 1 day to partially disconnect the left hemisphere and remove her left temporal lobe. 2 days after the first surgery, they went back to surgery to completely disconnect the left hemisphere.
Thankfully, that was it. She hasn't required any more surgical treatments.
She's been seizure-free ever since. She has a talent for music, picking up songs and following a melody, singing on pitch, knowing how to beat to the rhythm. But when I do reflect on everything that she's been through and how much she's overcome, the main thing I think of is a miracle. But then I also know that it wasn't an accident. It was the result of work and a dedication to excellent care and just being extremely fortunate to live in a place where these resources are available.